This is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to log on each week on Saturdays at 11 a.m. Central Time. Catch the Queen on the Home Health Queen High Tea Show. Peace. Good morning, good morning, good morning. Y'all, thank you. Good morning. Welcome to the Home Health Queen High Tea Show podcast. How is everybody doing this morning? Guys, you know how I get started. I always have to say give thanks to God because without him, none of this is possible. Y'all, today we coming in with a full 50 minutes of information regarding home health versus home care. Y'all, just to let you know, I do have my little trusted sidekick here with me today. I have my trusted sidekick. Y'all, I don't know if y'all know him. A lot of y'all have been seeing him travel the world with me. Y'all know I'm worldwide and certified within this industry. Y'all, this is my director of operations. Good morning, Derek.
Good morning, Queen.
How you doing? How you doing?
I'm good. I'm tired.
I know.
We've been on the road all week.
Yeah, that's what we do. We keep it moving and keep it grooving with the Queen.
Yes,
see, one thing about it, Derek, is I tell the people all the time, I ain't new to this, I'm true to it. And now that we got this podcast, y'all, we gonna make this thing shake, rattle, and roll.
That's what we doing.
That's
right?
what we doing.
Okay.
That's what we doing. Y'all know me, I'm gonna talk business, and I'm also gonna throw a little shade if I need to. So y'all may as well put your sunglasses on, because baby, I'm ready to rock and roll about this industry.
Lord, I left my sunglasses in the car.
What child, you should have bought them. Because see, last week it was my intro podcast.
I'm not gonna walk out here blind, huh?
Baby, you gonna probably so. Probably so. But listen, to all my people that are joining for the first time, let me say welcome. Let me say thank you.
Yes,
and one thing I do want to say is, if you are tuning in, no matter where you're tuning in from, if you are new to knowing about the Home Health Queen, I like to always start by giving you guys a little bit of information about myself. If you already part of the troops on that Tickety Talk or social media, you already know what I'm capable of. But let's just go ahead. Y'all bear with me while I do a little introduction of myself. I don't know if you tuned in enough to hear my promo, but you know, Derek, I've been in this game for over 20 plus years, and I tell people all the time, anybody can get a license within this industry, whether it's home health, home care, NEMT, assisted living, residential care facility, and much more. See, I'm not just limited to one scope in this industry, baby. I'm diverse.
No. Yes.
I'm diverse. You know, I've been doing this a long time.
And guess what? I've been rocking with you since day one.
Yeah, that's how it is. That's how it is. See, when
I know about what she can do.
All right, there you go. Know about what I done been through.
She's true to it.
I'm true to it, ain't I? I ain't new to it. I keep telling these people I ain't new to it. And as we do this podcast, guys, I just want you to know, you will be able to call in, Mr. Producer.
I got the number right
I was
here,
just looking for the number. I didn't have the number. So Derek is going to give y'all the number right now, and then we're going to jump into some business. We're going to jump into some phone calls, and we're going to make it do what it do. So Derek, can you tell the people the number? Now, y'all look. Last week, y'all showed up and showed out for me, and I appreciate you. I appreciate the love. I'm not going to cry this week because I had some people call in and made me drop a little tear. And so what we're going to do today, y'all, show up and show out, have your questions ready. I will try to answer everybody within the time frame that we have, and I'm going to be dropping this knowledge. So, Derek, what is the phone call that callers can call into today?
Yeah. We want to hear from you today. So call in today at 214-556-6239. Again, the number is 214-556-6239. And guess what? We have some people on TikTok. I want to give a shout out to Queen. There's several viewers you have. Dr. Gail James, she's on TikTok. So,
hey, Dr. Gail.
Yes,
Dr. Gail.
So yeah, TikTok family, call in. If you want to talk to the Queen, call in today. I know you guys like sending comments and messages on TikTok, but we want to hear from you. So again, the number is 214-556-6239.
Okay, great. Y'all, let's just go on and kick this thing off with a learning experience. Y'all, today's topic, Derek, we're going to talk about home care versus home health. And I might dibble and dabble just a little bit into that ALF residential care and our group home, if there's a need to. But one thing about it, let me shout out Dr. Gail on my Tickety Talk. Guys, you heard Derek when we first aired state, we have been a moving and a grooving this week. Y'all alone, this week I've been to Dallas, I've been to Atlanta, and I've been to Jacksonville, Florida. Ooh, your girl is tired, but I made it here this morning. And Derek, I want to say Dr. Gail owns 2 home health agencies that we are taking through the accreditation process for her to become Medicare certified. So y'all, that's gonna kick this off because Derek, a lot of people don't know there's a difference between home care and home health. Guys, I joke around about this a lot, but at Priority Consulting, I believe in sitting down with my clients to see what part of this industry will better fit you.
I thought it was the same thing.
I know you did. Yeah, but it's a difference. And see, let me tell you, this is the thing. A lot of people say, and look, y'all been on social media. They've been on social media, bless their little heart. They've been on social media talking about getting set up by these coaches, trainers, and gurus about home care. That's what they call it. Home care, I'm going to go ahead and just throw a little definition to y'all. Home care is nothing but non-medical. I don't care what state you are in. You are going into the patient's homes, and what they're doing is helping patients with their ADLs, those patients that need assistance with daily living activities, cooking, cleaning, bathing, dressing, toileting, escorting. Y'all, I just broke it down for you.
Non-medical.
That's non-medical home
Got
care.
it.
So there's a lot of coaches and gurus out here setting up home cares, but see, this is where I differ. This is where my knowledge and my elevation of what I know how to do. This is what we do. Oh, I know that song. I know that song. This is what we do. Oh, I know that song. I know that song. So there's a caller. Go ahead, Derek.
Oh, we have a caller. Welcome, caller. Who do we have here?
And where are they calling me from?
Hi. Good morning.
Good morning. Who do we have?
This is China Michelle from Houston, Texas.
China Michelle, I've heard so much about you.
Good morning.
Good morning. Yes, I'm a niece of a Priority Consultant.
She's my Tickety Talk. She calls me her auntie. That's my niece. Niece, thank you for calling in. I hear your wonderful voice. What you have going on, and what's your question for Queen this morning?
Yes, ma'am. I just had a question. So as you know, there are 3 different accreditation bodies, ACHC, CHAP, and Joint Commission. Which one do you recommend for your skilled home health agencies and why?
Oh, that's a good one. Okay, let's start with this. I'm an ACHC and I'm a CHAP certified healthcare consultant. I'm going to start with Joint Commission first. Guys, the 3 accreditation bodies are Joint Commission, ACHC, and CHAP. Joint Commission, I'm going to say no. That is not my accreditation body of choice because, guys, Joint Commission is an accreditation body that will come in and survey home health, home care, underneath the same rules and regulations as a facility, which when I say facility, that means hospital. Okay, so they expect you to operate just like a hospital, and that's when our rules and regulations really differ, but they still come in and they survey us on a certain portion like we are a facility, and I'm not rocking with that because that's not true. So you will never hear me recommend Joint Commission. Well, Queen, guess what? Somebody told me back in the day when you started your first company, you was Joint Commission accredited. Y'all, that's because when you know better, you do better. See, all I knew back then, Derek, was Joint Commission was hot. And I knew that gold seal. See, I had never really knew about ACHC and about CHAP. So I went on and tackled that JCI. But baby, let me tell you, as soon as I was able to be grandfathered out after having that accreditation from JCI after 5 years, baby, I went straight back to state and other agencies that I have my hands on. We are ACHC accredited. The accreditation bodies all do the same thing, ACHC and CHAP. They work as a second party surveying company for all states. Most states require you, China, most states require you in order to become a Medicare certified
agency, see, they require you to go through an accreditation body. They started this years ago because of all the what? Home care and home health fraud.
My
Girl,
God,
let me tell
today.
you. Let me tell you what they said. Them people said, this is what them people said. Them people said, you know what? Everybody getting these home health and home care licenses, we're going to make sure they have finances to be able to go through the process. So
They said,
whenever...
bring me the money.
Show me the money. Baby, show me that. Show me that money, ching, ching. Money green. Show me that money, ching, ching. Money green. Money green. So check this out, China Michelle. All of them have a set of rules through CMS, Center for Medicare and Medicaid Services, that they have to survey agencies across the board with. See, because when you hit an accreditation level, you're going to be surveyed at what we call crosswalks, 3 different crosswalks. You're going to have state, so you got to get surveyed based on that state rules and regulations, right? Then we're going to have accreditation body. We're going to do that across their rules and regulations. And then we're going to have your Medicaid or federal side for accreditation. So those are the differences. They all are the results will be the same. It's all a gold seal of approval of an healthcare accreditation. So that's basically it. They all run around the same amount of money, just JCI's a little bit higher. So I hope that answered your question. We're gonna release. Did that answer your question?
Yes, ma'am, it did. Thank you so much.
Now,
All right.
China Michelle, before you go, how long have you been working with the Queen?
I have been working with the Queen since, I think it was July of this year.
Oh, wow.
But it feels like much longer because I've seen so much movement. So I just want to thank her from the bottom of my heart for everything she's doing for my agency.
Well, listen, that was going to be my next question. Have you seen a change in your agency since July working with the Queen?
Absolutely.
Okay.
Literally within like 2 weeks. She flipped me
weeks.
from non-skilled to skilled. She's put me on to several gems in terms of diversifying my payer sources, and she's just been a wealth of knowledge, and I'm so appreciative.
Wow. Well, China Michelle, we appreciate you. Thank you for calling in. Thank you for being our priority client, and we love you for that, all right? Again, we want to hear from more of you today. We want to hear from more of you, so please call in 214-556-6239 to talk to the Queen.
Yes, please do that. And let me just tell you guys something. Thank you, China Michelle. Y'all, I am the home health queen. You know, there's a lot of people that's trying to imitate me. They can't do what I do. And let me tell you, people tell me all the time, Queen, you so cocky. Y'all, if you understood all that I've been through, I not only keep myself educated and elevated in this industry, I genuinely love this industry. I want to see you guys succeed. So what I want to do is, since that call just released, again, home care is non-medical. I don't care what state you in, you are limited when you are a non-medical agency. All right? When you are a non-medical agency, your payer sources are very, very limited. The only payer source for non-medical, the main payer source is traditional Medicaid. Wait, we got another one?
We got another call. All right. Caller, welcome.
Hi.
Hi. Who do we have here, and where are you from?
Oh, this is Siobhan. I'm calling from Houston, Texas.
Oh, H-Town again. All right, Siobhan, you're on TikTok right now too, huh?
Yes, I
see you.
am.
Well, good morning, Miss Siobhan. How are you? Thank you for calling in. H-Town in the house. I love to see them H-Town people come
finally
in.
I got you.
You finally got me. I told y'all I'm in high demand. Just look, anybody that's trying to call in and you can't get through, we here every Saturday, 11 a.m. Central
11 a.m.
Time. And all you have to do is log in to fbrn.us to get me. Siobhan, welcome. And what can I answer for you today?
Okay, so I have a question. Were there a time when, I don't want to use the word failed, I want to use the word unmotivated, when you were kind of struggling? I don't want to say struggling, like not getting things figured out.
Mm-hmm.
I just want to know what keeps you motivated to just like keep going.
Failure is not an option. Because see, if you're passionate about it, Siobhan, it's going to be many of those days you feel non-motivated. I keep telling y'all this industry will have your back up against the wall. But when you feel that, what you need to do is take a step back, go home, think about it and think about the patience and the amount of care that you're going to be able to give and the amount of people you're going to be able to help. See, one thing about this industry and one of the myths that I keep talking about when I'm on social media, and that's one of my big things with this podcast, I'm going to continue to tell the people the truth. Let me explain something to you, because I heard on social media, it's people out here talking about you're gonna become a millionaire, billionaire, and trillionaire real quick, and you're gonna make 6 and 7 figures. Baby, I want you to not look at that. Because if you're in this industry for the right reason, looking at those types of things, it will make you feel defeated. Okay? So this is the thing. When you feel defeated, step back, look at the purpose of you starting your agency, and come up with a plan. We don't have time to sit and wait, because when somebody needs help in this industry, you are a licensed home health agency. You need to go provide that help. So when you feel down, thank God for you being in the position that you're in to help others. Shake that thing off and keep going, Siobhan. Right into this day, 23 years later, it's a lot of time that I feel like, oh my goodness. Right? And then I come back and I get a phone call and it may be a referral. And then I get excited because I remember that I'm about helping. I'm about helping people's family. That's important to me. And it puts a smile on my face, because I know at the end of the day, I'm going to see results one way and or another. Just keep pushing, my girl. And thank you for calling in. Did that help you?
Yes, that really helped me a lot. Thank you, Queen.
No, thank you. Thank you. Thank you for calling in. All right. All right.
And Queen, that's good, because I've seen you throughout these 20 years, and you've been so passionate about what you do. Whether good or bad, you're passionate about it. I've seen you stay up all night, wake up early in the morning, right? And that's what it takes. If you want to be successful, right, that's what it takes. Work hard, be passionate, learn from your mistakes, learn from your failures, and just build on top of that. And that's what you've done. That's why you're the queen.
That's why I'm the queen.
That's why you're the queen.
That's why I'm the queen.
The only
That's why I'm the
queen.
king. I'm the only queen. Yes, yes, yes.
Yes.
And so this and then this, guys, as the phone calls keep coming in, y'all remember to keep calling. I am going to pick up off of where I left off. But what I was about to tell you guys now, home care is one of those industries where you do not have to be a RN or a physician to get into this industry. But depending on what state you are in, the licensing qualifications may differ. Okay, some states require you to have an RN to sit as a supervising nurse. There go my song. Hey, that mean a phone call, y'all. Okay, so let me just tell you that in some states you may need an RN to do RN supervision. In some states you will not. Okay, so yes, you can run a non-medical as long as you have the right credentials without an RN. Like in Texas, we don't require an RN. Okay, so I want to make sure that everybody understands the difference between non-medical, home care, and medical. And after I take this next call, we're going to dive into that medical side so you guys can actually understand when we talk in home care versus home health, the differences, because there is a big difference, all right? So do we have someone?
All right, yo. Who's on the call with the queen today? I just made that up.
Dr. Gail James.
Hey, who do we have here?
Dr. Gail James.
Woo!
Hello, Dr. Gail. Welcome.
Good morning, Dr. Gail.
Good morning, Queen. My thing is not a question, it's a suggestion. I have had you in my office for 2 days. I did a consultation before that. And I'm suggesting that you bring up a class to teach some of these coaches and people on TikTok what it really is, because they're out here taking people money.
Wow.
And they are not learning anything. Nothing. You are well aware that I'm Medicare approved in the U.S. Virgin Islands. And Jacksonville, Florida, I'm almost finished with my Medicare accreditation. Had you not come to my office, if those people came in on me, I would have flunked.
Wow.
And I paid a consultant bukus of money. So I feel like you need to do a training for these people that's out here. I'm going to say what it is, scamming.
Wow.
There go that word.
Wow.
There go that word, Derek. See, let me tell y'all something. Since Dr. Gail said it, I'm going to bring it on in. Dr. Gail, it has been a pleasure
Yes,
working with
darling.
you this week. I just left Dr. Gail yesterday. She dropped me off at the airport. Dr. Gail, let me say this because I'm using this platform to help people that is in the same situation as Dr. Gail. But see, people get real nervous, Dr. Gail, because you found me on social media, right? And so people don't know. They may think that I'm a scammer. But let me tell you, do y'all hear what Dr. Gail just stated? And this is the thing, Dr. Gail, you know me, you know my personality, you know my credentials. I have always stated, I may not know everything, but see, I've been in this game so long, Dr. Gail, I know where to go get the resources to make sure these people get what they need in order to pass survey. When I walked in Dr. Gail's office and she brought it up, I didn't. If the state would have walked in or ACHC, because we going through ACHC accreditation, guys, she would have been shut down. Dr. Gail, can I just say, I'm not going to say the name of your company because I don't want them people coming for you. This
They can
other
come. You know we pack over here.
I love it.
This other consultant, guys, listen to what I'm about to say. If you are a licensed, skilled home health agency, you cannot do anything without an initial physician's order. It is imperative. It tells you in the rules and regulations, the federal code, it tells us that you cannot move. You have to work underneath a doctor's order. There is a consultant in the Las Vegas, Nevada area that had, I'm not going to say such said agency, out here taking blank plan of cares 45s, if you know the terminology, if you license, to their patients' homes and telling them to take this piece of paper to your doctor and have them fill it out. Guys, how you gonna take a blank 485 to a patient first off? See, Derek, let me tell you, a 485 is generated after the doctor has already given an initial order and my RN has went in to do that assessment based off of that initial order. And then that 485 is generated and then we send that at that point to the doctor so he could sign off on the services that we are going to be giving for the next 60 days. Dr. Gail, baby, I came in with my superwoman coat on. And one thing about it is, see, that's where that training and that education part came in. And now I can say this, we ready. And you don't have to worry anymore. And I promise anybody that comes to Priority Consulting, I'm going to educate you. I am going to make sure that your agency is within compliance. I say it all the time. This is not an industry that's easy, Derek. But that's why I never wanted to be on social media. But Dr. Gill, I thank you for calling in. I don't want to hold you. I appreciate you trusting Priority Consulting and trusting that you allowed me in your wonderful office for 2 entire days. And before I let you go, y'all, Dr. Gail, tell these people about if they have not been prioritized, they need to be. And then when Dr. Gail releases, I'm going to take a quick break and I'm going to give me a look. I'm going to give me a little hydration. And then when I come back, y'all continue to call in. So Dr. Gail, thank you. I appreciate you. And I want to tell you again, you've been prioritized. So y'all, let's take a quick break and then don't forget to call in at 214-556-6239. Come on with them questions because guess what? Queen got them.
And Queen, I was supposed to say that.
Baby, y'all see I got that takeover spirit.
Takeover spirit. But again,
spirit.
we're going to take a break. I'm going to let the Queen take a break. Don't forget to call in at 214-556-6239. Peace.
Peace. Oh, peace. to talk about Atlanta. We're going to talk about Atlanta, too. We're going to talk about Atlanta. I want to talk about Atlanta. All right. All right. All right. All right.
We back on?
You back on?
We're back on air. All right. Did I get a phone call?
I think you did. I heard that little ding, ding, ding.
Ding, ding, ding. Hey, hey, hey. Who's on the call with the queen today?
I like that.
Pat Rock Starlin from Houston, Texas.
Baby, H-Town.
Yes.
H-Town. H-Town. Good morning, Miss
Welcome.
Pat. How you
Welcome.
doing?
Good morning.
Miss Pat, I'm so glad to hear your voice. First off, I want to say thank you for flying all the way to Atlanta. Guys, Miss Pat was just in a training with me this week in Atlanta. So, Miss Pat, what are you calling in to say, or is there a question I can answer for you today?
You know what? You did such an awesome job in the training in Atlanta. That's what I most wanted to say. I mean, my God, if you guys have not been prioritized, you better get on the wagon, because that training was off the chain. And I've been doing my business for 5 years. And so she did an excellent job with training. So if you just need a refresher, want to get your foundation solid. And so I do feel like that I am solid now with the foundation components. And I just want to let you know, you did an awesome job.
Thank you. Thank you.
Congratulations.
Thank you, Miss Pat. You know, this is the thing. Whenever I tell people all the time, whenever I touch down in other states, when I do my small private trainings, which I do, this training in Atlanta that we did this week, guys, was focused on laying the foundation with documentation.
And we had 20 people.
We had 20 people. We
We had to
sold
call
out.
an extra chair.
We
and
did,
table.
because really
Yeah.
we had 19 and I allowed one more in. I like to keep these trainings very, very small, because then they're more interactive. Miss Pat, did you feel like you were getting your questions answered directly and not in a roundabout way when you attended this training this week?
Everything was very forward. And I felt real relaxed because we was in a group of 20, but everybody was so attentive. All the questions they had was getting answered. It wasn't anything left undone.
Right. And that's what I like to hear. And that's why, guys, I say all the time, I love small group settings, Miss Pat. And so I'm so glad that you got everything that you came to receive. I'm so happy that you're proud and proud of me. And I'm so happy that you continue to allow Priority Consulting be your consulting firm of choice. So I appreciate you. I wish you nothing but much success. And you know we're about to take Georgia by storm. So I can't wait for the next steps.
And Queen, you serve
Amen.
food at
I'm
your-
ready. I'm ready. I'm looking for my office space, and so I am ready to go.
Yes, y'all, let me tell y'all something. I believe in expansion. Did you hear Miss Pat Rock say that she's a Texas-based, she has an agency in Texas. Now we're about to expand out to Georgia. See, that's the thing. That's the difference between me and others. I don't let my clients sit stagnant. I'm not gonna do it, because there's too much room for elevation when it comes down to this industry. So Miss Pat, get ready to be elevated, and we're gonna take Georgia by storm. And thank you for calling in.
Thank you, Miss
Thank
Pat.
you. Have a great day. Bye-bye.
All right, y'all heard it there. Now let me just go ahead and tell you guys.
What's coming up in March?
You know, I was thinking about that. I try not, this is the thing about me. Y'all know I like to keep it light and bright. I want to talk business, but we having a good time with this thing. But guys, for the people that are listening, my people on my Tickety Talk, I see you say you interested, Annette. How you doing? Annette name is Annette Building Wealth. Annette, call in to the show. Call in to the show. Annette, I want you to call. Derek, what's that number?
214-556-6239.
Annette, just write that down and go ahead and call in. I want to talk to you, girl. I like your name. That's what I'm talking about.
But yeah, what's going on in March, Queen?
Okay, so guys, let me tell y'all, March 14th through the 16th, I will be putting on, I will be your keynote speaker at the One Woman Show Healthcare Symposium in Dallas, Texas.
Dallas, Texas.
D-Town. Y'all know we gonna have a good old time. But guys, let me tell you this. my conference, we gonna have a good time, but it's all about education. It's all about learning. It's all about elevating. I am your keynote speaker. Center for Medicare and Medicaid Services will be blessing the stage in order to talk to my guests. Office of Inspector General will be there. These are the people that matter, not my homegirl and my homeboy. You see what I'm saying?
Right.
But I heard my like ding dong, ding dong.
But before we do that, we're going to have a party too, right?
Oh, yeah. Oh, baby, this who ready for the party.
I'm ready to turn up.
And for
Partying
y'all,
with the queen.
I did tell him your position with the company. This my director
Yeah.
of operations, y'all. He ready to turn up.
I'm ready
Always
to turn
ready
up.
to turn up. But see, and I'm gonna be honest. I told y'all this last week, the other day. I wasn't worried about no party.
Yeah.
I really wasn't. I wasn't worried. But now they got it on my mind. Y'all better bring your after 5 attire. It is semi-formal, and that ticket is only for the entire weekend. This is silly and insane. And see, I'm not throwing no Black Friday, cause see, this is healthcare.
Well.
Y'all, I don't have to do a Black Friday special. Cause see, what I do, I make sure that I give stuff people can afford. You know, there you go. Y'all, the ticket preach, queen, preach. Y'all, the ticket is only $649. And if you need a little PP, we'll give you a little payment plan. I don't have to go through Klarna. I don't have to go through
Layaway.
Now, there you go. Baby, I knows what layaway is about. Don't play with me. But do we have a caller waiting?
Who do we have?
You have Bags by K from Florida.
Welcome.
Y'all, let me just tell y'all, I love to hear people that I know. If you notice, H-Town done showed up. Dr. Gail, Jacksonville, Florida done showed up.
Yep.
And then we have a Florida person on the line. Let me just go on and brag on myself, because I keep telling y'all got a beast right here. See, I'm a real one. I am certified in all 50 states. All these are my clients. Hey, Bags by K.
How are you?
I'm wonderful. What can I answer for you today?
What I had wanted to elaborate on is, you always go over laying the foundation. You always give information on diversifying the agency. But what I want you to talk about, once everybody establish their license and you done taught them how to lay the foundation, could you bring in all the components together about why it's important to have a coach to help you go through the process of operating your agency, also credentialing, all of those things that you can bring to a new agency owner?
Absolutely, but my people be coming in with some questions, because they have to challenge me, because they know they have access to me, and we're always talking, and I'm always having my hands on them. So to answer your question, she gave like a 2-part question. So the first answer that I'm going to give you, it's important to have a good certified healthcare consultant. I be getting on Bags by K calling me a coach, but that's what she used to. But this is the thing. I teach and I train y'all to lay the foundation so you can be prepared for what you're supposed to be doing in that agency on a daily, weekly, monthly, annual basis, so you won't fall apart when the referrals start to take place. Because that's a whole nother area that you're gonna have to focus on. And if you don't have that foundation laid, when them referrals start coming in, then you have to focus on foundation and patient care and the financial side. If you don't have it laid, you're gonna crumble. This is where a good healthcare consultant comes in, Derek, is because I come in, I lay the process. So when she gets that first patient, she can call me and she can say, Queen, I need to know what to do with this referral. And then I'm gonna walk her through the proper steps, because if you've never ran an agency, okay, and nobody has ever shown you or taught you the proper steps. Honestly, I read a lot about this industry, but there's nowhere in any rules and regulations, there's nowhere in any chapter codes, there's nowhere in any state codes, there's nowhere that states what do you do when you get a referral. They tell us the requirements, they tell us the regulations, but most of the time, if you've never been in this industry, you got to figure it out.
Wow.
So that's where I come in, because I've been in the game over 20 years and this is what I do. So instead of you trying to figure it out and having the wrong steps put in place, and then state come in, Bags, and then you get all these citations like 32 pages, Bags. See, I come in, I clean it up, I give you the processes, and you don't have to worry. So that's what you need a good healthcare consultant to do. Now, secondly, credentialing. If you are in this industry, and this is when I talk about diversifying, especially you non-medical, you will be you will sit in one area when it comes down if you are just a private pay agency and or a Medicaid agency. There are other payer sources out here. Credentialing is the term that we use to go and ask insurance companies to allow us within their network so they will pay us for the services we provide. And if you don't get the proper credentials with certain insurance companies, you can't see those patients. Diversification. I train all my clients, Bags by K, get credentialed with every insurance group that is in your area. And if you become a Medicare, Medicaid certified agency and you're fully credentialed, you will be able to take any patient that comes through your door. See, I tell them all the time, don't play home health, be home health.
Wow. All right.
Because, see, it's no patient that I can't take. Look at her laughing. Baby, it ain't no patient I'm not going to take. And then let me just go on and throw something else on their bags for you. Even while you going through the credentialing process, I'm going to go on and give y'all a little knowledge. Get y'all pen and paper. I'm finna do it. Y'all, check this out. Even if you are not credentialed at this point and you are a licensed home health, no matter what state you in, you guys most likely can take any insurance that has the initials behind it, PPO. Because PPO benefits, see, this is why you have to be diverse in everything that you do. No, Queen, are you an insurance broker? Nope. But see, I'm very educated. I've educated myself in the insurance requirements because my patients have what? Insurance. Most patients with a PPO insurance have what? Out-of-network benefits, Kay. So like I told you, while we waiting on this credentialing process to be approved, baby, I'll be at facilities saying I take Blue Cross Blue Shield PPO, United Healthcare PPO, Aetna PPO, biggest day, because 9 times out of 10, them patients have out-of-network benefits. I may take a hit instead of getting paid 100% because I'm not in network. They may pay me 70%. You see what I'm saying, Bags? So that's the importance of credentialing. Did that answer your question?
It definitely did. And the last question that I have, and I'm going to let you go,
What you have?
is when there is investing. Because what I find out is everybody wants something for free. And like you always said, I don't give you millions, but I give you tools to get the million. What would you tell someone that is hesitant in investing into their agency?
One thing that I will say, and see, Bags by K know the questions to ask me because she talks to me all the time about business. It is a misconception, and I always go back to social media that you don't need money in this industry, guys. It takes money to make money, and I'm gonna give you. I love just throwing out little examples to let you guys see. I get calls every single day, Bags by K. People call in my office. And so for you guys to talk to me, I charge you for 1 hour, only $250. Because I do that not because I have to. I do it because I'm trying to see if you are about investing in the knowledge that you receive to step into this industry. And I tell people all the time, if you can't afford to spend $250 for some knowledge with somebody as much that is qualified as much as I am, that shows me you're not ready to invest into a business, all right, that for longevity. Because it's going to be a lot of days that money not going to come in, right? So you got to be able to invest in yourself to learn the proper steps in order to have a good ran agency. You see what I'm saying? So investing in your education, investing in the company, investing in your employees and your staff. It's more to it than just billing. If you don't invest, you can't grow. So the first thing that I tell people all the time, this is the industry you really want to be in, guys, sit down, get a pen, get a pad, write out what you want to do. And at what level you want to do it at.
Wow.
And I tell people all the time, if you are RN, don't come at me talking about you want to start a non-medical agency. Because I'm going to say, come on, let's get your money up. We going straight to skill. So Bags by K, that's what I have to say to you. That's what I have to say to you. And thank you for calling in. I appreciate you. And if there's not anything else, I'm going to let you go.
All right, thank you. Have a
Th-
great day.
Thank you. Thank you.
And
Y'all,
listen, we got 5 minutes left, Queen.
That's-
What happened to time today?
I told you, baby. Let me tell you, we be shaking, rattling, and rolling.
Wow, wow. But shout out to the TikTok audience. Like, they've
The
been
numbers are
rocking
up.
with us
Yeah.
all morning.
Yeah. Let me say something to the TikTok people for a
Yes.
second. Y'all, I see somebody said they can't call in right now, but that's okay. Listen, guys, I'm here every Saturday morning, 11 a.m. Central Time.
Yeah.
Hey, Rocky RN, I see you. What's up, Sean? Thank you for Siobhan. Thank you for the love. Let me just say this. And somebody, T Mile RD says Medicare, guaranteed money, no need to verify benefits. Okay, let me elaborate on that before we go. Let me elaborate on that. T Miles, I wish you would have called me in, but I'm going to elaborate on that. To all my Medicare certified agencies, what T Miles is speaking of, yes, there are no authorizations required for traditional Medicare patients when it comes down to home health, but there is a doctor's order that must certify them in order to pull that benefit, okay? So, yes, it's no authorization required. And I'm going to be honest with you. T, I'm going to go on and correct you just a little bit, T Miles. I'm finna correct you. Guaranteed money is across the board. See, I hate to hear when people say, I don't mess with MCOs, they don't pay. Now it's your bill of TD Miles. Because you know what? If you're in this business, right, Medicare, yes, they pay, right? But so do MCOs. So I tell all of my clients, come get and talk to me about diversification, because it's all about how you bill, what you're billing, and making sure that your documentation equals that billing, and you'll get paid. So I don't turn down nothing. We take traditional Medicare, Medicaid, MCOs, VA. It's all pair sources called diversification. So T Miles, thank you for rocking with me, and thank everybody. And let me just tell y'all something. This 50 minutes goes by so quick.
Yeah.
It goes by so quick.
And so much fun.
It's a lot of fun.
So much fun.
And I try to keep it light and bright. I do try to throw in little nuggets, but we do have special guests that are going to be joining me over the next couple weeks. I'm going to have a guest speaker from Anthem. Over the next couple of weeks, I will be setting up a guest speaker, Dr. D.L. Wallace. And these are people that are going to be blessing us at the conference as well. And then we're going to take the last call of the show. So y'all bear with me. Let me see if we
Yo, who's on the call with the Queen today? You got 2 minutes.
Yes, good evening. How are you both doing?
Wonderful.
Thank you.
And this is Annette, who loves to build wealth. I'm calling in now.
Hey, Miss Annette, thank you. You on my tickety talk, and I saw you had a question. I said, ooh, I like to talk to you, so thank you for calling in. What can I answer for you, my love?
Well, love, I would love to get in this space, in this business, because I am all about building wealth. And my experience is in healthcare. I'm still in the hospital working as a healthcare, and I'm looking to do my own business. So I tune in just in time, because God always put me in the right place at the right time.
Oh, I like to hear that. What city and state are you in?
I'm in Philadelphia.
Okay, good. Well, I'm happy that you found me. Are you new to my Tickety Talk, or have you been following me for a while?
I just found you, hon. I just found you.
Wow. Well, thank you so much.
Yes.
Thank you for the follow.
You're welcome.
And I'm going to give you a little homework, and then we're going to get out of here, and then we're going to talk about it next Saturday, same time, same place, fbrn.us, 11 a.m. Central. So this is what I need you to do.
Yes, ma'am.
I need for you to go to your state's licensing website. Okay?
Okay. Yes.
And I want you, whether you're thinking about going into home care, which is that non-medical, did you understand the differences that I broke down today? Non-medical is home care. Medical is skilled, is home health. That means skilled, RNs, LVNs, PTOT, medical social worker.
Yes.
There you go. So
yes.
I need you to go to your licensing website, and I want for you to see which one of those and read about them, look at the application, and pull the rules and regulations. I want you to start reading.
Absolutely will.
Because
and I'm getting ready to move to South Carolina soon. So
okay, well look,
yes.
wherever you go, Priority Consulting. I told y'all I'm certified in all 50 states. I thank you for calling in, and y'all, that's gonna do it. It's a wrap. It's a about 50 minutes ain't enough
I'm
time.
going on that website right now, honey, because I want to get through this.
I want you to print it out, put it in a 3-ring binder. That's homework. Queen believes in giving homework. Y'all don't forget, whenever you need. If y'all have any questions for me, y'all can always reach me at thehomehealthqueen@gmail.com. Priority Consulting at 713-401-9771. Y'all, if y'all want to go check out my conference, Miss Annette, I need you to go get a ticket. Y'all go to the Home Health Queen Conferences with an S.com. That's everything about the symposium you need to know. And if you need to get a ticket and need a little PP, don't be afraid. Email me at
I already marked it down on the calendar. That's March. It's in March, correct?
March 14th to the 15th. And Miss Annette, get off my phone.
I already got it there.
Girl, bye. Get off my phone. I got to get off these people podcast show with somebody else coming up. To all my people, I love y'all. If you don't follow me, Derek, thank you, homeboy.
This was fun.
Thank you. And I'm going to have some other guests on here with me. And y'all don't forget, follow me on all social media platforms. I am known as the Home Health Queen. Peace.
Hey, this is the Queen, host of the Home Health Queen High Tea Show, broadcasting live each week on Saturday at 11 a.m. Central Time from the Fishbowl Radio Network studios in Bedford, Texas. Log on to hear all things home care and home health. Listen in to get all the tea, because I'm going to bring it to you, whether it's home health, hospice, assisted living, and much more. So be sure to log on each week on Saturdays at 11 a.m. Central Time. Catch the Queen on the Home Health Queen High Tea Show. Peace.
Hey, this is Stevie B with the Am I Worth the Time show. We want to invite you to check us out every Monday evening from 5 p.m. to 7 p.m. with the Angels, Lady Jackie Holly Bell, Lady T, and Nikki C, right here on the Am I Worth the Time show
on FishbowlRadioNetwork.com. Jump in.
Hi, this is Diane Marion Eunice, and I am a licensed marriage and family therapist. For the past 9 years, I have worked with over 300 couples in the areas of sexual health, communication, and conflict resolution. If you are interested in rebuilding connection and intimacy with your partner, please contact me today. I can be reached at 682-201-8175, or you can email me at diane@letstalkrelationships.org, or visit my website at www.letstalkrelationships.org. And remember,